Dr. Kadish, talk about the times where you feel that CPAP has benefited a patient in the hospital setting and the frequency of use, in the hospital setting, not only in the ER, but in general.
Sure. CPAP, similar to adult patients, prevents intubation in children. And we use it pretty regularly in the emergency department. And the kids that we use it in most often are our asthmatic population, especially our really any age child with asthma, but in particular, our teenage asthmatics are usually the ones who come in the sickest, and we use it a lot in them. And I think it's a great sort of tool to prevent intubation in this population where we really don't want to intubate them. And then the other ones are our little babies, the ones who come in with respiratory distress for other causes. Most often it's bronchiolitis, which is a viral infection in those smaller airways of the lungs. And so we use it a lot in those babies as well. I would say a lot of our emergency department visits are for respiratory causes, but that's more common in the younger age group. So we're using it a lot in those younger kids, infants up to 2, 3 years.
One of the things I really like that you just said, and this was something that has kind of grown since then, is that asthmatic respiratory distress child. That's one thing that I think protocols right now are missing, except for maybe a few. I was so happy that you said that. The asthmatic patient was your number one reason to put them on non-invasive positive pressure ventilation, which is what CPAP and BiPAP is. So I'm really glad that you said that because we are starting to have experience with it and saying, okay, just like in adults, that nebulized treatment during the CPAP is really helping them because we're opening up alveoli and getting that deeper and deeper. So that's awesome that you said that.